Welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, and today I'm interviewing Katrina Sanders. Welcome, Katrina.
Hi, Vanessa. Thank you for having me.
I'm glad you're here. Now, Katrina has been a practicing clinician for over a decade, yet she has never delivered an IA nerve block, but she has also consistently achieved successful mandibular anesthesia. Why is that significant? Because we're going to be talking about her course, Local Anesthesia, New Techniques, the Latest Trends, and Troubleshooting. This is exciting. Thank you for being here and sharing this, Katrina. Now tell us, why is this course significant for the dental provider?
Well, fabulous question. First of all, I know everybody's probably doing the math. Like, she's been practicing for a decade. So did she start as a hygienist when she was 2? Yes. This particular course is so important because in dental school and in dental hygiene school, we are taught the basic injections that we need in order to be successful in clinical practice. However, as we all experience, once you get out into clinical practice, some of the injection techniques that used to work in school now all of a sudden aren't working with our patients. As a dental provider, that's embarrassing when we maybe have ineffective anesthesia. Our patients certainly question our judgment. The assistants kind of are looking at us like, are you sure you know what you're doing? So it's important for the dental provider to be able to appropriately deliver the injection, but more so be able to deliver an injection with confidence. So this course truly goes through, it unpacks the different types of injections that we did learn when we were in school, and it goes over some of the anatomical considerations. Sometimes we start to see interesting anatomy in our patients, and it's important to review what those injections look like. But there's also incredible research out now about amazing new injections that I think are incredible assets to the dental practice. So we go through the anatomical considerations with these new alternative injection techniques. As you mentioned, I have not delivered an IA nerve block in over a decade. That is true. And in fact, I do work in clinical practice where I am hired by my doctor to deliver anesthesia entirely. I not only deliver anesthesia for restorative, but also endodontic, oral surgery. And the type of anesthesia that I do is oftentimes integrating a lot of these alternative injection techniques to make sure that our patients are comfortable and profoundly numb. So I think it's an incredibly valuable asset to be able to provide these types of injections into the dental practice as a confident provider.
Exactly. That's great. I mean, that's really exciting. So, Katrina, tell us a little bit more about what we learned in the course and how this course is taught. Is there much hands-on or interaction, or tell us more about the vibe and what we're doing in the course, as well as, just getting down to a little more of the details of what do we learn?
Sure. Well, I'm incredibly passionate about this topic, and I think that just kind of bounces off the walls when I'm lecturing on this topic, because I do believe, particularly with our IA nerve block, for example, that we are setting ourselves up for failure when we do this injection. There are so many reasons why this injection is not a successful injection for us as providers. So my first goal is for everybody to feel a little bit better about the fact that we're maybe not successful with the IA nerve block. I bring along with me, several skulls. And so we actually are able to open up the models and take a look at what some of these anatomical considerations look like on a skull. So I love that, because as the skulls are moving around and as people are evaluating, you can see them locating those bony structures. So it workshops really well. And I think the best part about it really comes from the providers understanding what these alternative techniques look like, then getting into private practice on Monday morning and delivering those injections. One of my favorites is when I get tagged on LinkedIn or Facebook or on Instagram from a participant who went to my course and tried the Vazirani Akinosi after coming to my course and nailed it, and the patient was comfortable and it was an easy injection. Those are my favorite moments. So it definitely workshops well, but the success comes from when my participants go back into the operatory on Monday morning and confidently use those injection techniques with their patients.
Exactly. That's where the rubber meets the road, right? That's how we get a return on investment for attending. Now tell us a little bit more about who is this best suited for, as far as the team and the provider, and also what would be the typical length, the suggested length of this course?
Mm-hmm. So your typical providers, dentists and hygienists are going to be the audience, although I have had some assistants come to my course. Not that they can deliver injections, but they love learning about all of the different types of injections that their doctors are doing. And there is definitely a huge interest. So I have had some assistants come in. I would say the course can expand and contract depending on the depth and the focus of the course. So I do unpack the injections that we learned about in school. And we can go into depth with those, or we can certainly do a review and then move on to the alternative injection techniques. Ideal length of the course is 3 hours, although it certainly can be beautifully delivered in 2 hours as well.
Is there anything else that would be important for the meeting planner to know as they're considering bringing this to their meeting?
I would say the most important thing would be to, as meeting planners already do, consider what the dental community needs with regards to continuing education. And although an injection technique course can review a lot of the things that we do learn in school, it's important to remember that a lot of providers do love to have those course refreshers where they're reviewing the things that they learned and being able to integrate a lot of the injection techniques that they've maybe read about in articles, but they want to be able to confidently deliver. And as a content expert in local anesthesia, I love being able to talk to the participants afterwards or show more techniques on models, look at pictures, and really help to instill that confidence so that your participants are able to take what they learned in my course and beautifully integrate it into their private practices.
Well, there you have it. Thank you, Katrina, for sharing with us on your local anesthesia course. Thank you for tuning in. And if you would like any more information about bringing Katrina Sanders for your next event, be sure to visit dentalspeakersbureau.com, where you can learn about all of her courses and we can help get you in contact with Katrina. Thanks again for tuning into this version of The Buzz. And until next time, be well.